So what is G60? It's truly just a form of aggressive care. It's a paradigm shift. And what do I mean by paradigm shift? When you think of trauma, trauma is gunshot wounds, stab wounds, motor vehicle collisions, motorcycle collisions. Well, believe it or not, now the number one cause of trauma, or the number one mechanism of injury, are falls. And then you have to say, who's falling? What's people over 60? Well, what are these people like over 60? These patients are not laying in a nursing home, that this is a different age, that the baby boomers that we're dealing with now are very active and they're very strong. And I'm sure everybody's seeing it. You know that your 80-year-old father or mother is out playing golf or on vacation, or they're active. And if we don't start thinking of them the same way we think of the 20-year-old and the 30-year-old, we know they're active. They come to the hospital, we fix them, we get them out, we're very aggressive with them so they can get back to their life. And I think we need to really change our way, or again, this paradigm shift with trauma patients. And so we really believe that G60 trauma should be a part of every hospital that takes care of trauma patients. That even if you're not a trauma center, you can still use the G60 program no matter what hospital you're in. We can still share protocols, we can still share guidelines, we can still all sort of have this form of aggressive care, but for sure in the trauma center. So who should lead a G60 program? A surgeon should lead it. And you may say, well, why a surgeon? Surgeons, we're trained to be aggressive, get a patient fixed, get them back to where they were. The hospitalists, who are some of my dearest friends, they're trained to take care of chronic medical problems. That's what they're trained to do. And so whether it's the orthopedic surgeon or the trauma surgeon, somebody's got to lead this aggressive care, getting the patient fixed and getting them out and back to their daily activities. And we have to lose our former way of thinking that, well, a fall is not a trauma, that's a medical problem because they have high blood pressure and diabetes, and so we put them on the medicine team. They're a trauma. They broke their bones, they broke their ribs, they may have fractured their spleen, they may have had a concussion or a head injury, and they need to be on the trauma team, and it needs to be aggressive, and it needs to be a way of thinking that we manage these patients differently, but aggressively, we get them taken care of and get them back home.